with a whole host of you who are interested in our DNP nurse anesthesia program. This is a very exciting adventure that we have stepped into with Penn State Health and the Milton S. Hershey Medical Center College of Medicine to offer this program. I just can't tell you how excited we are to have gotten to this day. We have already made major steps. Many of these things you will hear about as you move through the evening toward our initial accreditation, which of course we must have in order for all of you to come into our program. And we just cannot wait until May when we will be inviting some of you to walk through the doors and begin your nurse anesthesia program. There are a host of people who are going to be presenting tonight, introducing themselves, and then carrying out a program. I look forward to all of the questions that you will ask and hopefully to meeting some of you in the future years as you determine your eligibility and readiness to come into this program. So I think without further ado, I'm going to turn this back to Dr. Sarah Rollison, who will be leading this program, and I believe will start off going through introductions tonight. Sarah, is that right? Go to you first.
Sorry about that. You should be good, Dr. Rollison.
Thank you. I was like, I can't unmute. I'm in Zoom jail. Thank you so much, Dean Badzek, for joining us. I know everybody, her name says Sarah Rollison. She's not. There's only one of me, unfortunately. But Dean Badzek, thank you so much for joining us tonight. And thank you, everybody, for being here. We are going to go ahead and start recording this session. Oh, thank you. It's already recording. Perfect. And we're going to start sharing our slides. Cody, if you wouldn't mind sharing our screen, that'd be wonderful. While he's pulling that up, as Dean Badzek said, we are so incredibly excited to be at this stage. As many of you know, and as we've wonderfully heard from everybody in the community, this program is something that a lot of people are excited about, and we are just a few of those people as well. We're going to just briefly review our agenda, if you wouldn't mind on the next slide, Cody, for us. So you've heard from Dean Badzek. We're going to briefly all introduce ourselves. Cody's going to speak a bit about the university mission. I'll give you some details about the program overall. You'll hear from our Assistant Program Director, Dr. Megan McAuliffe, about simulation and clinical experiences throughout the program. We'll touch briefly on our scholarly project process, and then our Educational Program Coordinator, David, will talk about our admissions process, and then we'll open it up for you for your questions. Some general housekeeping. As you saw, we can't unmute ourselves, so please just make sure that you stay on mute in case that ever changes. We appreciate to see everybody whose camera's on, but we appreciate if you can't turn yours on either. And also, please put any questions that you might have in the chat. We will, at the end, moderate those, and we will hopefully get through as many as we can. And so we can fast forward to Vincia's slide, and I'll ask if she is able to unmute herself and introduce herself.
Yes, thank you, Dr. Rollison. Good evening, everyone. My name is Dr. Vincia Pandian, and I serve as the Associate Dean for Graduate Education here at the Ross and Carol Neese College of Nursing at Penn State. I am truly delighted to welcome you to this DNP Nurse Anesthesia Information Session. Our graduate programs are designed to prepare nurses for advanced practice, leadership, scholarship, and meaningful impact in healthcare. And the DNP Nurse Anesthesia program is an important part of that mission, preparing highly skilled nurse anesthesia professionals who are clinically excellent, evidence-informed, and committed to safe, high-quality patient care. And so we're grateful for your interest in Penn State and in this program. So I'm hoping that this evening's session is an opportunity for you to learn more about the curriculum, expectations, the application process, and the kind of learning community we are building. So just like Dr. Rollison mentioned, I encourage each of you to ask questions and use this time to determine whether Penn State is the right fit for your professional goals. Thank you. I'll hand it over back to Dr. Rollison.
Thank you. And you've already heard from me. I'm Sarah Rollison, the program director for the brand new nurse anesthesia program. I'd like to pass it off to our assistant program director, Megan.
Hello, everyone. I'm Dr. Megan McAuliffe, and I am the Assistant Program Director for the inaugural Penn State Nurse Anesthesia program. I wear a couple other hats in the program as well. I am also the Clinical Education Director and the Simulation Director. Welcome, and we really appreciate you joining us this evening.
Thank you, Megan. We'd like to also introduce one of our very wonderful partners in this journey, Dr. Jennifer Parks, the Chief Nurse Anesthetist at the Penn State Health Milton S. Hershey Medical Center.
Good evening, everyone. It is so exciting to see so many of you joining us this evening. It's even more exciting to be a part of this mission. And, it's wonderful to see this dream become a reality. We have an outstanding leadership team, and Dr. Rollison, Dr. McAuliffe, Dr. Pandian, and Dean Badzik, and then even wonderful, our outstanding clinical partners through Penn State Health and Penn Highlands hospitals that are going to prepare you all to become outstanding providers and the future of our profession. So thank you all for joining us, and this is a really exciting time.
Thank you, Dr. Parks. I'll ask Mr. Cody Hoffman to introduce himself.
Sorry, I fell asleep at the wheel there and missed your slide, Dr. Parks. But hi, I'm Cody Hoffman. I'm the Assistant Director of Nursing Student Recruitment for the Ross and Carol East College of Nursing. So I've probably been in touch with a good number of you already. We've had a lot of you asking questions about the program now for a while, and we're very excited to finally have this information session to share more details and to hopefully continue to generate interest as we head into the application cycle and beyond, and I will be happy to continue answering questions from here on out and helping however I can.
Thank you, Cody. And then I'll have Mr. David Kyvik introduce himself.
Yes, hi everyone. Good evening. Thank you so much for being here tonight with us. My name is David Kyvik. I'm the Educational Program Coordinator for our Nurse Anesthesia program, and just echoing everything that's been said already, we're so excited for to get this program up and running, and so thrilled that you all are able to join us here and express your interest in being part of our very first cohort. So thank you for being here, and looking forward to getting to meet you guys and present a little bit about this program.
Thank you, David. And although we don't have a slide for her, I would like to acknowledge that Ms. Morgan McAfee is on. She is our Director of Strategic Communications and Marketing at the College of Nursing.
Thank you, Sarah. Hi, everyone. It's so great to be here with you this evening, and I'm looking forward to getting this program off the ground. It's been a ride.
Yes, thank you. All right, we can go to the next slide. Before we dive really far into this wonderful presentation, I do want to start by just providing a blanket statement about our current accreditation status. So this is a brand new program. If you didn't know that before now, welcome. We are just starting this program. We are excited to say that we've begun the initial accreditation steps, and we successfully hosted our accreditors on site in April. However, accreditation is currently pending final approval from the Council on Accreditation of Nurse Anesthesia Educational Programs. No students can be enrolled until this accreditation has been awarded. The current time frame is that we would anticipate receiving accreditation or notice of this in October of 2026, so this coming October, which is well before any students will start in May 2027. So I wanted to provide that. And now I'll pass it off to Cody to start giving you some information about Penn State.
All right, thanks, Dr. Rollison. So many of you on this call may already be familiar with the Penn State system. Either you're a graduate of one of our nursing programs or another program here, or you might work for Penn State Health System. Some of you might really be learning about Penn State for the first time. So we just want to give you some background on what our institution is all about and who we are. So Pennsylvania State University is a multi-campus land-grant public research university. We are known around the world, really, for our educational endeavors, for our research endeavors. It is our pleasure to serve the people of Pennsylvania as well as people all around the world with the different programs that we offer. And we do our best to incorporate the values of the Penn State system in everything that we do. I think you'll see evidence of that throughout the presentation tonight of how these values are incorporated: integrity, respect, responsibility, discovery, excellence, and community. Within the Penn State University ecosystem, we have the Fox Graduate School. So that is the umbrella that sort of encompasses all of the graduate education programs at Penn State. So they, of course, have a mission to provide the highest quality education to all graduate students and to prepare our students to be leaders in whichever field they decide to enter. And that's something that we definitely feel is our duty here within the Ross and Carol Neese College of Nursing. We always like to say we are building nurse leaders, and the Fox Graduate School certainly supports that mission. The Ross and Carol Neese College of Nursing is a separate entity within the Penn State ecosystem, again, to use that nice, tidy word. We might be new with this program for nurse anesthesia education, but we are not new to nursing by any means. Our first nursing students enrolled in 1965, and we have slowly grown over the years from a department of nursing to a school of nursing, then to our independent college of nursing in the year 2013. And in 2021, we were transformed thanks to the generous gift Ross and Carol Neese into the Ross and Carol Neese College of Nursing. And we are continuing to use that gift into the future to transform the way that we're able to provide education for generations to come. So why should you choose Penn State? Over all of the other choices that are out there, we like to highlight a couple of things that make us stand out, we hope, in your mind. One of the key things is that we are able to provide the resources that you expect from a large, internationally known, research-focused, multi-campus land-grant university, but we are still a small college of nursing within that larger Penn State system. So you can expect a lot of individualized attention within and to have that support that you need to succeed. This is going to be a small program as well within the larger scheme of the university. So you can expect to have those supports in place if you should ever need assistance. We have one of the largest alumni networks in the world, Penn State. So wherever you go, you're going to find those Penn State connections. I can't tell you how many times I've been in an airport wearing a Penn State shirt and someone shouts "We are" at me. It happens everywhere you go, and there's no corner of the globe really that is untouched by the influence of Penn State. So you are carrying that distinction with you wherever you go throughout the rest of your career and your life. The Neese College of Nursing was also named a Center of Excellence in Nursing Education by the National League for Nursing. That is a distinction that we wear with pride, and we think is really an underscore of the fact that we are delivering a high-quality education that is recognized by a well-respected national body. And you can expect, even though this new program, like we said, to have the distinction of a recognized university that you can carry with you. Also, some details on post-graduation outlook. You probably don't need me to tell you this. You probably all are very aware of the opportunities that exist out there for CRNAs now, but there's projected job growth of 35% through the year 2034, and there's already a high demand for CRNAs out there. CRNAs are the highest paid nursing profession as well. So salaries are high, demand is commensurate with that, and we expect that our graduates will have plenty of opportunities going forward in their careers to really excel and to lead the profession. And I see there was a note in the chat that I might have been breaking up, so I'm sorry if you couldn't hear me the whole way through. I apologize for that. But I'm going to wrap this up and send it back to Dr. Rollison now, so hopefully it won't be an issue.
Thank you, Cody. I think we got the majority of what you were saying. I do really want to just reiterate that Penn State is a huge name and it's got the resources of a huge university, but it has the feel of a very small university. So while we do have vast resources, vast support, you will also be in a relatively small cohort. We'll talk a little bit about our class sizes a bit later, but with that, I want to just briefly talk about the details of our program. As Cody spoke about Penn State's mission, we also have a mission within our program to really cultivate nurse leaders with a commitment to education, innovation, and excellence. So what that means to us is that you won't just be that CRNA who meets expectations. You won't just be that CRNA who gets the minimum numbers. We want you to be the CRNA who goes above and beyond, who is providing excellent care to patients of all acuity levels, who is dealing with diverse patient populations, who is maybe becoming the administrator, the preceptor, educator, the politician. So we really hope to foster and build on the PSU values in our program. And you can go to the next slide. Thank you. So just some program details. I do want to stress that, again, Penn State is huge, very large. We have multiple campuses throughout the Commonwealth of Pennsylvania. This program specifically will be based at the Hershey campus in about South Central Pennsylvania. So we are located just adjacent to the Penn State Health Milton S. Hershey Medical Center. And the program will be 36 months in length with a May start and a May end. This is a full-time plan of study. There is no part-time option for this. Students do need to be nearby as we are an in-person program from day one. Our plan of study, we'll go through it in a little bit more detail, but we start with the first full year of didactic education with simulation interwoven and starting to focus on the DNP project. In years 2 and 3, students will begin clinical, so they'll do all of those wonderful things, but now have more of a clinical focus. And eventually the courses will trajectory out so that you're doing mostly clinical by the end of the program and preparing to sit for boards. Currently, we are anticipating an inaugural cohort of 15 students. So we do anticipate a 1-to-5 faculty to student ratio. As we get started building the program, we hope to hire more faculty so that as the program grows, we have more and more faculty to support that 1-to-5 student ratio. You can go to the next slide, please. As promised, our plan of study is broken down by year here. You'll see that we start in the first year in summer in May next year, 2027, and you'll begin with fully didactic courses. Advanced health assessment will have some simulation built in throughout it, so you'll start lightly with sim in the summer, and you'll take chemistry, physics, and then physiology. In the fall, you'll really hit the ground running with even more simulation that Dr. McAuliffe's going to talk about with your Principles of Anesthesia Practice course. And you'll take pharmacology, pathophysiology, and you'll begin your DNP scholarly coursework with colloquium. In the first spring, you'll again progress on to the Principles of Anesthesia Practice 2, which is where you get prepared for clinical practice. And this is your pre-clinical course that prepares you for that entry. You'll also do more work with your DNP project and get deeper into anesthesia pharmacology. Next slide, please. In year 2, you'll see that you begin year 2 with clinical starting 2 days per week. We will gently ease you into clinical. You'll do 2 days per week, eventually progress up to 3 days per week in the fall, and then 4 days per week in spring of year 2, which will be the continuation for your program. You'll be in clinical for 4 days a week after that. You can see how your courses again kind of shift a little bit less into the didactic anesthesia realm and a little bit more into the DNP project realm. This is also when you'll be doing your project implementation. Next slide, please. In year 3, finally, we end with some final courses for your DNP project to wrap things up. A professional aspects or professional role in nurse anesthesia course where you learn about advocacy and a lot of different factors that influence anesthesia practice across the United States. And then you'll have your board review courses. And that wraps up the 36-month program. I know it sounds easy just looking at these slides, so hopefully it'll feel that easy when you're in it. I'm going to now turn it over to Dr. McAuliffe to speak more about the simulation experience.
Oh, hi, everyone. Cody, you can go ahead and go to the next slide for me. Great. So our program utilizes a state-of-the-art simulation center that is located on the Milton S. Hershey Medical Center campus, which is where our program is housed. The facility is specifically designed and equipped with a variety of advanced technology and specialized equipment that is really going to meet the educational and training needs by supporting you, the student, through experiential learning throughout the anesthesia curriculum that Dr. Rollison just discussed with you. To note as well, our students will have 24/7 badge access to some designated skills training areas, really allowing for flexible self-directed practice throughout our program, which is fairly unique. Next slide. Our simulation is scaffolded throughout the nurse anesthesia curriculum, beginning in the summer of semester of year one. And this really serves as a teaching strategy that is going to support the progressive development of cognitive, psychomotor skills, and some of those clinical decision-making skills. Very early in the curriculum, simulation is based on allowing students to practice really those foundational skills before entering the clinical environment. And as students advance through the program, the simulation activities are going to increase in complexity, which is going to require the integration of those technical skills which you initially learn, combined with that critical thinking, communication, and leadership while managing more of the rare or high acuity scenarios that are intentionally aligned with concurrent didactic and clinical content. Next slide. We're going to jump into clinical experience now. Next slide, Cody. Our program currently utilizes 7 affiliated clinical sites to provide you all with diverse and comprehensive clinical experiences. Students can expect to rotate through up to 7 clinical sites, with rotations ranging anywhere from 1 to 4 months. And that's going to be based on students' level of progression throughout the program, site-specific learning opportunities, as well as specialty experiences. Next slide, please. While all of our clinical sites provide a very diverse range of general surgical specialties and experiences, students are also going to be assigned to specialty rotations that are going to be distributed across these clinical sites. When we talk about specialty rotations, we are talking about a very focused clinical experience that is going to provide exposure to specific patient populations, maybe more complex surgical procedures and advanced anesthetic techniques that may not be encountered very consistently in just the general operating room assignments. There are 4 major types of specialty rotations. They will include cardiac, obstetric, pediatric, and regional anesthesia. To note here, we do have 2 designated distance clinical sites. That's going to be Penn Highlands Du Bois and Penn Highlands Tyrone. They are designated as our distant clinical sites, and what we mean by that is that these sites are located greater than 60 miles from the Hershey Medical Campus. Next slide. The clinical practicum rotation is going to begin in May of year 2. These courses are sequential. They are supervised clinical experiences that are going to be designed to integrate that knowledge that you're learning in the classroom setting with the hands-on patient care throughout the perioperative setting. And during these courses, you will progressively assume greater responsibility in the delivery of anesthesia care. The Council of Accreditation does require that our students complete a minimum of 2,000 clinical hours over the course of the program. We anticipate that our students will achieve closer to 2,700 hours. And the combined case volume within these 7 sites also confirms that our students will likely exceed the COA's minimum anesthesia case requirements of 700 cases. Next slide, please. As the assistant program director and the clinical education director, I will largely be responsible for developing the clinical rotation assignments to ensure that each of our students are going to meet all of the COA clinical experience requirements. The dates and lengths of the clinical rotations are going to change based on the number of students assigned to each clinical site. They're dependent upon overall cohort size, the available experiences, as well as student level of progression throughout the program. With regard to the distance clinical sites, we really aim to make these assignments fair and equitable for all students. But it is important to note that all students are eligible to rotate to a minimum of 1 distance clinical site, and this could potentially be 2 distance clinical sites. Students are responsible for their own transportation to and from clinical. You may choose to secure accommodations near your site, but all related expenses are going to be the responsibility of the student. Students at distance clinical sites are expected to return to the Hershey campus for any in-person classes, simulation labs, or any other educational assignments. Next slide. The daily clinical schedule is going to include various shift lengths, and this can range anywhere from 8 to 16 hours. Specific clinical sites may require extended shifts to really maximize that access to your clinical experiences, so just keep that in mind. Students are also going to be required to be assigned to call shifts per the COA, and this is to facilitate exposure to that high acuity, time sensitive, often emergent urgent surgical experiences that you may not experience during those typical daytime shifts. Call shifts can include off-hour shifts. They can even include overnight shifts, weekends, and holidays. An example of that would be a weekend 12-hour shift, 7A to 7P or 7P to 7A. And then during the weeks, it can range anywhere from 3 to 11 p.m., 11 p.m. to 7 a.m. So just keep in mind that there is going to be some variability there. We do keep in mind that we want to ensure that we are promoting safety and effective learning. So the total time commitment is not going to exceed 64 hours per week, and we average that over a 4-week period. This time does include clinical and class hours, so we are very mindful of that. And then also to note, students will have a minimum of 10 hours between those scheduled clinical shifts to promote rest and recovery. Next slide, please. I'll turn it back over to Dr. Rollison to begin discussing the DNP scholarly projects.
Yes, thank you, Dr. McAuliffe. I'm just briefly going to touch on the DNP scholarly project process. If you'll go to the next slide, Cody, thank you. So just to remind everybody, the requirement now for practice is a doctoral DNP degree, DNP or DNAP. We had changed in 2025 that all nurse anesthesia programs needed to offer a doctoral degree as the terminal degree. So because of that, completion of a scholarly project is a COA requirement. With this project, the goal is to help demonstrate knowledge and scholarship skills by addressing a clinical or practice problem. Really, we're not trying to reinvent any wheels here. We are doing a lot of quality improvement, identifying issues that exist within our partner clinical sites and helping them address them through evidence-based practice approaches. So the expectations of students is that you'll learn how to perform literature searches, critically appraise evidence, synthesize that information, and express understanding of these concepts. Currently, the plan is it's our intention that our DNP projects will be done as group projects with a central topic. So we are hoping that we will be able to identify groups who have similar topic ideas and make sure that you are all assigned to topics that fit your scholarly interests. Currently, the DNP project process is done individually at the College of Nursing, and so there is always the option that that could be a student's pathway. However, the group project process is going to be the standard for the nurse anesthesia program. And you can go to the next slide, and I believe I'll pass it off to David to speak about some student resources.
Awesome. Hello, everyone. So as for student resources, we can change to the next slide here. We, of course, allow a lot of our main resources for students, including academic advising, mentorship, wellness and counseling, financial aid, student disability. And in addition to the fact that we are based on the Hershey campus, so we get to offer a lot of the additional resources that Hershey does provide for our students, including the wonderful Harrell Sciences Library. Are you able to hear me a little bit better? Yes? Awesome. And I would say that a lot of, or all of our resources you can find on the College of Nursing's homepage. So I'll be sharing a couple websites with you all for you to view in your own convenience, and I'm actually going to post them in the chat. I'm ready for the next slide, Cody, please. As far as our time away from the program, we have an academic calendar for the first year with scheduled holidays and breaks. In years 2 and 3, there is it's your time away from the program is subjective to the clinical schedule. So there is an allowable time off policy that we're introducing in years 2 and 3, and you must use it's required that you use 5 per semester in years 2 and 3. You'll also be allowed 4 days professional time off for board reviews and conferences. And then we also have included a funeral and bereavement time policy as well, as we've been developing this program. I'm ready for the next slide. I just wanted to transition over to our admissions. And before I do that, I just want to encourage you all to look at our DNP Nurse Anesthesia home webpage with our comprehensive list of admissions criteria. Next slide, please. We're just starting with a holistic admissions statement. And this really means that Penn State University's DNP Nurse Anesthesia program, we've designed our admissions process to holistically review our applicants from a well-rounded range of qualities, experiences, and accomplishments, ensuring fair and equitable evaluation for every applicant. And you can read these statements on our website as well. They're present. Next slide, please. This is a large list of our admissions criteria. Again, this is available on our nurse anesthesia website. I want to highlight 3 program-specific admissions criteria, and that includes we require 8 hours of shadowing with a CRNA, and that there's a CRNA shadowing log that is available to download that you can download and print out to fill, and that is on our website. We also require 2 years of full-time critical care experience, which we do provide a more comprehensive definition for what qualifies as critical care and what does not. And we will address that later on. And then we also require completion of undergraduate or graduate level statistics and chemistry courses within the last 5 years with a grade B or better. Just to give you a general overview of our timeline, we have our application period, which begins June 1st through September 1st. That is the time period where you'll be able to submit your initial application. That follows by our interview period, which will take place sometime between mid to late September, maybe potentially into October, and we'll render our final decisions no later than November 30th. Candidate acceptances require a formal acceptance in our graduate admissions decision system and a non-refundable $1,000 matriculation fee to secure your spot in the cohort. You can skip to the next slide, Cody. In the interest of time, we have worked to compile a list of our most frequently asked questions and areas of interest in regards to our program. And that is the 3rd link that I've included in the chat for Zoom. So if any of these topics listed here are questions that you have, I would first recommend going to our frequently asked questions list to just take a glance through and see what we have posted publicly available. Think that at the same time, myself, and Cody are also available if you have a more specific circumstance or inquiry that is not necessarily covered on our website. We're always here and available as resources to contact. Ready for the next slide. I just wanted to go in a little bit more detail with our 2 prerequisite courses, statistics and chemistry. The nurse anesthesia program does not accept Portage learning courses or courses from University of California, San Diego extended studies courses. These prerequisite courses must be from an accredited institution. They can either be in person or hybrid, or in a virtual component. They must be a grade B or better, and a lab component is not required for chemistry. We do prefer biostatistics if possible.
I think that's all I have for right now. We do want to thank you all again. I know it is late on a Wednesday night if you're on the East Coast or to the east of us. Thank you so much for your interest. We are blown away by everybody being here. It's our inaugural session, so we can't express how much this means. And Dr. McAuliffe, Dean Badzek, Dr. Pandy, and Dr. Parks, Cody, David, Morgan, we could not be anything without all of them. So I just want to thank them for being here as well. And I hope you all have a great night. Please don't hesitate to reach out with any questions. We look forward to seeing your applications.